Welcome to Women Lead, a production of the Women of Color Empowerment Institute. We are your hosts today. I am Bernadette Norris Weeks.
And I am Michelle Austin Pammies. We have two special guests for you today. They are experts on the issues of health disparities in women of color, Dr. Regina Davis-Moss and Dr. Anique Bryan.
Across America, there has been varied government responses to how states and cities should deal with the COVID-19 crisis. More than 460,000 Americans have died thus far, and the lack of coordination has brought to light systematic cracks for people of color in particular.
The American healthcare system has some of the most brilliant and innovative doctors in charge, but the system is constrained by the reality that many Americans do not have access to healthcare. The pandemic has pulled back the curtain on disease and social ills impacting people of color.
Michelle, everyone should be concerned about their health, and this show is a show for everyone today. And so I can hardly wait to get really in depth with the physicians that we have that are going to speak with our audience, and these physicians are really qualified professionals.
We will be back shortly with our first guest, Dr. Regina Davis-Moss.
Imagine yourself in a new Toyota. With great deals, get ready to turn your dreams into reality.
Right now, during Toyota's Ready, Set, Go event, lease a new 2021 Toyota RAV4 LE for just $249 a month for 36 months. That's just $249 a month on the Toyota RAV4.
Ready, set, go get your Toyota today.
Toyota, let's go places.
The Florida Lottery is proud to support education by contributing billions of dollars to Florida schools and awarding countless Bright Future scholarships so Florida students can do more than just dream of a brighter future. They can create one. Learn more at flalottery.com.
Welcome back to Women Lead. We are pleased to have Dr. Regina Davis-Moss, Associate Executive Director of Public Health Policy and Practice for the American Public Health Association. She oversees numerous issues of public health, including policy, practice, professional development, climate, health, and equity in her role. Welcome, Dr. Davis-Moss.
Well, hello, ladies, and thanks for having me.
Dr. Davis-Moss, how are you? We're happy to have you here today. My first question for you is, giving you some background, it sounds that you do many things in your role at the American Public Health Administration. Tell us about your organization and who it represents.
The American Public Health Association is the oldest and largest membership organization of public health professionals in the world. We work to promote the health of all people in every community, whether that be through tracking disease outbreaks like COVID, advocating for science-based policies like wearing your seatbelt, or encouraging healthy behaviors.
Sadly, many of the health concerns in the country come down to wealth and access. People who do not have money often cannot get the health care that they may need. In your opinion, are policymakers moving in the right direction in addressing the wealth versus access gap?
So the causes of health concerns are complex, but you are right in that they do not happen by chance. And differences in health and income are a significant factor. Evidence has shown that people on the socioeconomic stairs generally have better health than those that are a step below. And this is what we call the social gradient. And it's seen globally. We see it in low-income countries, we see it in middle-income countries, and we see it in the United States. And while we do have safety net systems in the United States so people that don't have money can get care, it's more than just putting doctors and clinics in every community. You know, it's that saying, if you build it, they will come. Well, just because you build it here doesn't ensure that they will come. We know that our current healthcare system does not serve all patients equally, and that if we really want to make sure that people have quality care, it has to be patient-centered, it has to be respectful, and it has to meet people where they are. So we have to address barriers like location, we have to address barriers like hours of operation and transportation. How will people get there? In terms of how policymakers are crafting policies, I think that we have to focus on funding resources and support so that struggling families can have secure income. This is how we're going to really have a major impact on social determinants and health disparities. And speaking of social determinants, I am seeing that we're moving more in the direction of talking about more of these issues in the context of social determinants of health. So that's basically understanding that everything that happens outside of the doctor's office is just as important if we really want to improve health outcomes.
Many times we talk about public health from the perspective of deficiencies and what's wrong. Doctor, tell us, what is going right?
So that's interesting because we often say in public health, when it works or it's going right, we're invisible. You can basically go about your daily life without worrying about if your food is safe, if your water is clean, or if the air you're breathing is fresh. It's not really until something goes wrong, like with COVID, that we recognize the value of public health. But thankfully, there are a lot of public health professionals with knowledge and expertise that can help us come through these outbreaks and pandemics. But in terms of our invisibility, it's mainly because we face budget cuts and we're asked to do more with less funding. And what we really do need to do is shore up our public health infrastructure.
Correct data is important to performing public health analysis. What is the recent public health data showing pertaining to people of color, and how can such data be utilized to impact public policy formation?
Well, it shouldn't be a surprise, but COVID is on track to become a leading cause of death along with cancer and heart disease. We're using data to track testing, we're using it to track vaccine administration, and we're particularly focused on minoritized communities because they're being hardest hit by the pandemic. We're also now seeing that Black Americans are being vaccinated at far lower rates than white Americans. In general, data is essential and it's critical if we really want to evaluate the effect or impact of public health programs. We tend to use it in a variety of ways. It shows us where we need to focus our efforts. It shows us whether or not an intervention is working, but it also shows us where we are getting it right, and it also shows us how we might be able to replicate it in other communities. This is what we use to drive policy formulation. The data is used to influence a public policy, and it's used to demonstrate the need or the potential impact of a policy.
Let's focus for a bit on Black people. We have shorter lifespans than white Americans and often suffer from obesity, heart disease, diabetes, and some cancers at higher rates. We recognize that this is a meaty question, but how can these issues best be addressed?
We can address shorter lifespans by recognizing that it's not simply a health behavior issue. And honestly, that some communities have more resources and opportunities to better support health-enhancing lifestyles than others. Absolutely, we should be physically active and eating a healthy diet most days of the week, but it becomes harder to do that when you don't feel safe in your neighborhood or you aren't paid a living wage and you can't afford quality health care or you can't buy healthy food to eat.
Infant and maternal mortality rates in the U.S. are worse than anywhere else in the developed world. Talk with us particularly about infants and mothers of color and tell us what can the U.S. do better.
I wish it weren't the case, but literally from birth through death, we see poor birth and reproductive outcomes in women of color. Black women are almost 4 times more likely to die from pregnancy complications than white women, and infants born to Black and Native American women are more likely to die than infants born to white women. And if these infants survive, it's just an insidious cycle. So over the last decade, a few researchers have hypothesized that chronic stress and racial discrimination and the social inequality it causes may be the cause for these racial differences that we're seeing in poor outcomes. And essentially what they're saying is that this chronic stress causes a physiologic response known as fight or flight. So think about it, if you are in a chronic state of fight or flight syndrome, it creates a lot of wear and tear on your body, and that is what is contributing to these poor birth outcomes. I do want to note that sure, poverty and lack of education can be causes for this chronic stress, but we're seeing these outcomes among Black women who are doctors, lawyers, and have college degrees and more.
American mental health care is often criticized for not being accessible to enough people. In your opinion, what will bring progress and access in this area?
We have to recognize that mental health is a public health issue. About 1 in 5 Americans are affected by a mental illness. That's about 20% of adults in this country. Depression is a public health issue, not only because it's a chronic illness, but because it can lead to so many other health problems, like overeating, like not being physically active, or worse, suicide. A lot of people see difficult life experiences as part of their everyday life, or they just see it as part of their narrative. They tend to say, hey, I'm just going to let it roll off of my back. But we really do have to help people understand when or how to seek help. Think about COVID right now, for example. It's created a lot of increases in social isolation, a lot of increases in stress, and it's also decreased the protective factors that we tend to lean on when we're going through difficult times, like social connectedness or human connectedness. And also, if you think about this when COVID is over, it's going to likely have some lasting impacts. So if we really want to see progress in this area, we would have to remove stigma. We have to help people understand that good health is not just that you're not sick, but it's complete physical, mental, and social well-being. We also have to help our insurance companies understand that covering mental health conditions like substance abuse and the others have to be covered in the same way that we cover our health care.
There is a narrative that has been suggested that African Americans are resistant to getting the pandemic vaccinations and having research performed on them in general. Do you find that this premise is true, and if so, why?
Well, I wouldn't say Black Americans are resistant to the vaccine and research in general. I think we're very interested in the findings and how things are developing. In fact, a recent study by the Kaiser Family Foundation found that 43% of Black Americans are taking a wait-and-see approach when it comes to the vaccine. I think what you're seeing is a legitimate reaction to questions about safety, does it work, and are there any long-term side effects? We have to listen and we have to acknowledge that there are concerns, and we should not challenge that. I would just say that, there is a long history with regard to mistrust of research in the healthcare systems by Black Americans. And unfortunately, that mistrust has been reinforced over time, and it's not going to go away quickly. We have to provide the science-based information so that people can make informed decisions, and we cannot force people to do things that they're not comfortable with.
At the Women of Color Empowerment Institute, our mission is to enhance and expand leadership by women of color. We do this in a variety of different ways, including but not limited to providing mentorship opportunities for young professionals where we assist in helping to create paths to leadership. We empower women to develop capacities for social change. We produce programs that promote heritage awareness, and we provide training opportunities for business and government. Our institute holds seminars focused on professional success techniques, and we host many other events such as our popular Advocates for Change and Leaders Connect. The Women of Color Empowerment Institute publishes a magazine called Women Lead. Our signature event is the Women of Color Empowerment Conference, a yearly conference where hundreds of leaders gather from all across the United States and beyond. To learn more about membership and how you can support our programs or be a sponsor of the Women Lead TV, visit us at nationalwomenofcolor.com. Again, that's nationalwomenofcolor.com.
The Florida Lottery is proud to support education by contributing billions of dollars to Florida schools and awarding countless Bright Future scholarships so Florida students can do more than just dream of a brighter future. They can create one. Learn more at flalottery.com.
Welcome back to Women Lead. I have with me today Dr. Anique Bryan, and Michelle and I are continuing our discussion about health disparities. And Dr. Bryan is someone who is no stranger to the Women of Color Empowerment Institute, Michelle.
Not at all.
She has been our resident doctor, so to speak. She's spoken at many of our conferences. We trust her immensely. And I've known, full disclosure, Dr. Bryan Geez, since 1984?
At least.
At least. So we have been friends for a very, very long time, and she's one of the very trusted and respected doctors here in the South Florida community. And welcome to the show.
Thank you so much, Bernadette and Michelle, for having me. I'm honored to be here.
We're honored to have you.
Definitely, we're very pleased to have you, and we have access to someone in Dr. Bryan who's familiar with the South Florida community and can provide us some guidance on that hot topic, which is healthcare disparities impacting the African American community. So Dr. Bryan, my first question for you is, what types of diseases do you see in your family practice on a day-to-day basis that disproportionately affect African Americans?
That's such an important question, Michelle. So I am fortunate to be a primary care physician for a cardiology group. And so while I do have my own practice within a practice, I see a variety of patients with multiple medical problems. And then, of course, because it's a cardiology practice, we are focused on treatment and prevention of heart disease. And as a matter of fact, heart disease is the #1 killer of all Americans. And unfortunately, African Americans about 30% more likely to die of a heart attack than other ethnic groups. And that has to do a lot with their genetic predisposition, and as well, the fact that there are risk factors that affect African Americans more greatly than other groups. For instance, #1 is hypertension. There's also diabetes, high cholesterol, and just high lipids in general, and then obesity. So a large part of my practice is treating those patients with those conditions. The other risk factors that African Americans have and they're affected more disproportionately is stroke, asthma, and even, and I don't see this a lot in my practice, but the infant mortality rate is a lot higher amongst African Americans than it is other ethnic groups as well.
There's been a lot of talk about health disparities and the fact that more African Americans die from COVID than other groups. Have you come across that at all?
You know, I have. I will tell you that it's been quite a challenge to deal with COVID for all of us, something that we just did not expect. And unfortunately, because of those risk factors and comorbidities, which means that patients may actually have more than one condition at the same time. They may have high blood pressure and diabetes and high cholesterol and be obese. So that puts them at greater risk for being susceptible because their immune systems are not functioning at a maximum. And when you throw in difficulties with access to healthcare and healthcare disparities that happen in the African American community, then that just increases the morbidity and the mortality rate among that group.
And what are some of on the issues of barriers, what are some of the barriers that may limit African American access to health care?
Right, so one of the biggest ones is economic, all right? And some African Americans, of course, who live in lower income areas may just not have that access or funding to be able to get to see a doctor because a lot of them are uninsured. However, because of the recent Affordable Health Care Act that came in to play a few years ago, you do have a decreased number of African Americans who are uninsured now. So it is a little bit better, so that has helped them gain access to see a doctor. The other thing may be sometimes based on zip code. African Americans may live in a certain zip code where there are not a lot of healthcare facilities in that area. Lack of funding, accessibility, if they're in more rural areas, and so they're unable to get to see a physician at the beginning of their illness. And so that leads to more complications. Something else has to do with, there's such a thing as wealth, inequality, and poverty that also plays a role. And so all of these issues come across as barriers for African Americans to not only gain access to health care, but also be treated once they're in the office, because a lot of times they're a lot further along in their disease process than other ethnic groups, especially whites.
The Florida Lottery is proud to support education by contributing billions of dollars to Florida schools and awarding countless Bright Future scholarships so Florida students can do more than just dream of a brighter future. They can create one. Learn more at flalottery.com.
Right now, during COVID again, there's been a lot of talk about the mistrust of the African American community with respect to the medical profession and the medical community as a whole. When you look back at the Tuskegee experiment,
Right.
because of COVID, that question has come up in the context of vaccines.
Right.
But generally, is mistrust a factor that suppresses access to health care?
I think that it does play a role, and with historical good reason, of course, because of the Tuskegee experiment that you mentioned. And then, if you look back in history, I mean, there is documentation of doctors performing procedures on slave women without using anesthesia and perfecting those procedures until they eventually performed them on white women who were able to get the anesthesia. So that mistrust doesn't come out of thin air. It's there. The other thing is, I think that a lot of times patients will go, African American patients will go to an office and they may not find a doctor that looks like them. And so they're not necessarily able to relate to that person. And the physician also may find that there are cultural differences that sort of widen that gap. So when it comes to COVID, one of the things that I have made a point of doing is making sure that I let my patients know that I have been vaccinated for COVID-19, that I've had both vaccines, and that I'm still okay. And that I've reassured them and let them know that the same concerns that they had, the same reservations that they have had, I have also had. Mine more particularly to do with the fact that we don't have any long-term studies that are going to let us know if this vaccine is going to be effective, what kind of long-term effects there will be. So that was my reservation, but at the end of the day, we all have to come together to get rid of this pandemic, and especially in the African American community where there's more risk factors that could put them at greater risk for being sicker with COVID or having a higher mortality rate. It's so important that they feel comfortable in getting vaccinated.
Definitely. It's a cost-benefit analysis, right? You're
Absolutely.
looking at it. Would you rather risk having COVID
Yes.
and perhaps dying from it,
Yes.
or take a vaccine that's, as of right now, we don't know anything in terms of negative effects, and there have been millions of people vaccinated?
Correct.
What action can the medical establishment take to begin to close this healthcare gap we've been talking about today?
Right. Well, I think first of all, you have to acknowledge that there is disparity to begin with. And I think a lot of my colleagues, especially those that are not ethnic minorities, have a hard time accepting the fact that there are these disparities, because in medicine we take an oath, and we take an oath to treat everyone equally. And so the first thing you have to do is acknowledge. The second thing that you have to do is, I believe, be accountable. So the medical establishment has to be accountable for the fact that there are these disparities, and look at all the factors and try to figure out what we can do to close the gap. One of the things that's interesting is that for men and women going to medical school nowadays, there are actually more women going into medicine. Probably about 51 to 52% of women, of the entering class of a medical school are actually female. However, out of the males that are entering, only 2% are African American males. And so a lot of times there's that discrepancy there as well, whether it be economic or just lack of mentorship. And so I think as a medical community, we need to also address what's happening with our doctors. Because the fact is that studies have shown that patients, regardless of who they are, will see a doctor, and it really doesn't matter to them what their doctor's race or ethnic group is. Even in the case where the patient is white and the doctor is African American or some other minority group, it really doesn't matter as long as the doctor is competent. But I think in order to really close this gap, bridge the disparities, you have to have an understanding of who your patient is, what their background is culturally, what their barriers may be economically. And sometimes when you do have the same ethnic group with doctor and patient, it's one step closer in closing that gap.
In those cases where you may not have a quote-unquote woke doctor who understands that there are disparities and maybe doesn't want to see them, what can one do in order to open the eyes of that doctor to receive better treatment?
That's a great question. Again, that comes from awareness, and I think for me, I can only speak for myself. when I do speak to my colleagues, and they're all excellent physicians and they have dedicated their lives to helping people, but over the years you may find that in conversations sometimes something is missed or overlooked, not in the diagnosis or treatment of the patient, but in a sensitivity to where the patient may be coming from. And so for me, as a minority woman, as a minority physician practicing, I think I have an obligation to open that door of conversation with my colleagues. And sometimes it's just a matter of being aware that, you know, maybe we need to take that extra step because this person may not be able to have the access to care that other patients do.
And just as a follow-up on that issue, I've read several articles where some medical professionals believe for some reason that African Americans and other minorities have a higher tolerance for pain. Mm-hmm. And I'm wondering, in your in your career, have you heard those studies and what's being done, if anything, to address those kind of issues so that African Americans and other minorities receive the right kind of treatment for chronic pain?
Right. Those studies do exist. I will tell you that I have not personally dealt with anything untoward with respect to that, but it does exist, and I'm not really sure where that myth came from, but that probably has to do with those studies way back in the day.
A New York Times article, I think.
Yes, yes. Well, it has to do with those studies that did happen, and the historical fact that anesthesia was not used in a lot of black patients, and so that's where that came from. But I have patients of all ethnic groups and all races and nationalities. Some are more stoic than others. It's really an individual thing, and some of it may be cultural, but not all of it is. So I think we need to, as healthcare professionals, we need to be sensitive to the fact that the condition that a patient is having may be painful, just the condition itself, and that it doesn't really matter what the ethnic group of the patient is. They need to be treated equally.
It's going to be difficult to overcome the issue of having more African American males, for example, as physicians, and generally to address issues of multicultural differences in medicine. So we thank you so much for having come to speak with us. We're so pleased, as usual.
Thank you.
As usual.
It's an honor to
with
be
your
here.
comments, Dr. Bryan, and I'm sure that it's going to be something extraordinary for our audience as well to hear what you have to say.
Thank you so much.
That's our time for today. Thank you so much for joining us for Women Lead. And until next time, be empowered.